This is a quick video to show how to take summary estimates from a meta-analysis and apply them in Gradepro to generate a absolute risk difference or mean difference between groups for a binary outcome. So I've signed into Gradepro. I'm going to click New Project. And this project is post-hospitalization. All right, so now we're going to add a management question. And the intervention is 7-day follow-up. Comparison is usual care. And it's used for post-hospitalization. So maybe not the perfect formulation, but it'll do. And then we're going to add a management question. We're going to add an outcome for that management question. And we'll just do the ED visits. Let's edit the new outcome. ED visits. And it's within 30 days. So anytime between discharge and 30 days. It's a dichotomous outcome. We're going to use a pooled estimate from our meta-analysis. So we set up and then save. Okay. And then what we want to do is enter the data. So there were 5 studies. I'm guessing they're randomized trials. We're going to say the risk of bias was serious. We'll add an explanation later. I'm just going to make up some ratings here to support the overall. So conclusion, we're going to say serious imprecision, and we didn't find other problems. Okay, so from the meta-analysis and the intervention, there were 2,362 patients in total, and I'm just going to make up that 10% had an event. That'd be 236. You would pull the event rate, obviously, from the meta-analysis. And then the comparison, I'm going to make up that, let's say 14%. Now, let's say 12% had the event. So that would be 283 out of the 2362 in the comparison group. It will also allow us to do a bit of a sensitivity so that we can vary from a plausible low to plausible high. And so let's say that in some populations, the event rate may be as low as 8%, and in others, it may be as high as 25%. So we'll apply those. Only 3 control risk values can be set. Okay. All right. Now we need the relative effect. And so it's going to be an odds ratio because that's what we have in this particular meta-analysis. And the odds ratio for an ED visit was 1.04. Confidence interval range from 0.83 to 1.30. Apply those results. And then Gradepro does the rest. So it tells you that at your base case of 12% in the control group, uh, which, yes, from your control group, that there would be 4 more um, ED visits per 1,000 with a 95% confidence interval ranging from 18 fewer to 31 more for the intervention or for the with the relative effect. And I'm guessing, I didn't look at this, but I'm guessing the odds ratio was for the usual care versus intervention. I'm not sure. You just have to get the direction of that right. And then it'll show you for your plausible range. So if it was a 8% rate in the usual care or natural history group, it would be 3 more with this confidence interval. And if it were in a higher risk population with a 25% ED visit rate, it would be 7 more per 1,000 and then range from 33 to 52. So really that's all there is. As you have additional outcomes, like I think we have a composite outcome, you would just name that. You could give it a short name, the follow-up, the type, again, a pooled estimate if that's what you have, and enter these values for the numbers of patients. And then Gradepro will also, once you've filled in the remaining information, it will assign an initial certainty for the estimate of effect. So hope this is helpful.